My name is Tyler Middleton. I'm the Doctor of Physical Therapy here at Stonebridge Health. Today what we're going to touch base on is we're going to talk about what is dry needling, how it can help you, and then what's the difference between dry needling and acupuncture. We'll go over who could benefit from dry needling and also who really shouldn't have dry needling. So what is dry needling? Dry needling is basically the use of needles to create a chemical response in the body without using medicine. Depending on what area we're treating, we'll use different lengths of needles or we'll use different widths of needles. It really just depends on how deep the tissue is that we're treating. A major question I get a lot is, how do you know what to needle? And it really depends on where the patient's pain is and where their stiffness is. We're trying to target areas that are abnormal tissue. Sometimes you might hear about a trigger point, and if you think about constant pain to the body, your body sees that and it causes the muscles to tighten up, and that's the abnormal tissue that I'm talking about. If we hit it with a needle, we get it to release, we get it to bleed, we bring in new blood flow, kick out the old blood flow, we can get it to heal itself. So people ask me, how do you know where to go with dry needling? And it really depends on where the patient's impairment is. Are they having tightness? Are they having pain in certain areas? Another major question I get with dry needling is, what is the difference between dry needling and acupuncture? The major difference is dry needling, we believe in balancing the body's homeostasis. With acupuncture, they believe in balancing the body's meridian or chi. They follow a map of the body. Let's review proper precautions with dry needling. The first one, cancer or any active infection. Any bleeding disorders. Pregnancy, anything in the first trimester. Artificial implants, and recent surgery less than 6 weeks old. Dry needling is going to increase blood flow. We don't want to push active infection through the body. And it's never great to needle in the first trimester just because we don't know what's going to happen with the pregnancy. Who would benefit from dry needling? Anybody that's experiencing pain or limitation in motion, they would definitely be a great candidate for dry needling. Someone that could really benefit from dry needling are people suffering from tension headaches and migraines. There's a way that dry needling can break up the pain cycle and stop the process of a migraine headache. There are different types of dry needling, different techniques. One technique, we use e-stim onto the needle where we attach an electrical current into the muscle to help with increased circulation and getting the muscle to relax. I look forward to personally meeting you here in the office at Stonebridge Health with any questions you have about dry needling. Let's get you back on the road for a pain-free life.